Hello, my name is Libby Scarborough, and today we're going to be talking about stroke and stroke assessment. First, a little background information. There are two types of stroke. First being an ischemic stroke, which accounts for 80 to 85% of all strokes. Then there's a hemorrhagic stroke, which accounts for the remaining 10 to 15%. Now, the ischemic stroke is caused by a blockage, usually a blood vessel, and those are detected by a CT scan. Whereas a hemorrhagic stroke would have to be detected by an MRI because it is an actual bleed. Now, we cannot move on without mentioning what is called a TIA, a transient ischemic attack, which is really a warning sign that the stroke could be coming very soon. Did you know that 50% of the patients who experience a TIA have an actual stroke within 48 hours? So we need to look at all the factors that we can to improve that. It could be modifiable or non-modifiable areas within our life that we can use or do or change to prevent those strokes. The non-modifiable are age, gender, heredity, those type things. The modifiable ones would be diet, exercise, diabetes, hypertension, those type of things. Those things that we can make changes within our lifestyle that may affect or prolong having a stroke. So now we want to move on. I'm going to wash my hands, put on my gloves, and I have my patient here ready for me to assess. And we're going to use the NIH stroke scale in this assessment. So the first part of the assessment, I'm going to answer the first 3 questions within a few introductions and questions to him. But first, let me go to say that in the NIH stroke scale, you score from a 0 either to a 2, a 3, or a 4. But the focus is the 0 because the 0 represents normal. Anything else, it's the severity of. So, hi.
Hi.
How are you today?
I'm doing okay, I think.
What's your name and what brings you to the
My
hospital?
name's Mr. Jenkins, and I don't know, I just had a little bit of memory lapse, and I felt like maybe my right side was getting a little bit weak, so I didn't want to chance it, so I thought I'd come in and get checked out.
That was the right thing to do. Thank you for coming in. Now that answers the first 3 questions within the NIH stroke scale. So now the rest of the stroke assessment has to be completed. Now remember, time is of essence because the more time that you spend, the greater the tissue damage. So we want to do everything within a timely manner, but in a thorough manner. So now we're going to use another test, and it's called a gaze. And a gaze is where we're going to do the finger test. He's going to look at my finger, and he's going to follow it from side to side, starting
Should I
in the
move
middle.
my head when you're doing that?
Oh no, I'm sorry.
Okay.
Please keep your head still and just follow my finger from side to side. Now he scores a normal for that particular function. Now the visual fields are going to be next, and that's where you're going to take your right hand and put over your right eye. So in this test, we're going to test for his visual fields. Now, first of all, I need you to look at me and tell me where my hands are. Just look up, tell me where my hands are placed and which hand is moving.
Your hands are out by your shoulders, and your right fingers are moving.
Great. So then we have to check his other side. So remove your hand. Now place your left hand on your left eye. And we'll do the same. Which hands are moving and where are they located?
They're by your shoulder, and it looks like both of them are moving.
Very good. He scores a 0, which is normal for that particular test. Now we are going to do what is called a facial movement test. And that's where, Mr. Jenkins, can you please smile for me and show your teeth? Okay. Okay, what we're looking for is drooping. Then can you close your eyes and squint them? Very good. You can open them. And now can you raise your brows? And for that particular test, again, he scores normal. Now we are going to test for his motor functions. And that is when he is going to raise his arms, and then I will count to 10. So, please raise your left arm and I will count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And put it down. And then your right arm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And put it down. And he scores a 0, which is normal for his motor function. Next, we're going to assess for his motor functions of his legs. Now, on this test, Mr. Jenkins, I would like for you to raise your one leg at a time, and we will count to 5. Are you ready?
Ready.
Okay, let's start with your left leg. Raise. 1, 2, 3, 4, 5. And your right. 1, 2, 3, 4, 5. Thank you. Again, that scored a 0 because it was normal. Now we are going to do what is called limb ataxia. And that's where I'm going to demonstrate Mr. Jenkins to you. That's where he is going to bend his knee and place it on his shin and then stroke down. Okay? And so we'll do that with both legs. So take your left heel, place it on your right shin and stroke down. Very good. Now we're going to take your right leg, place it on your left shin, your right heel, and then stroke down. Thank you. Again, those are normal. So he would get a 0 for that one, which is still good. Now we are going to do a sensory test. And a sensory test is he is going to close his eyes. Can you close your eyes? And then we're going to see if he can, if he knows where I'm touching him.
Right arm. Left arm. Right foot. Left foot. Right side of the head and face. Left side of the head and face.
Okay, you may open your eyes. Thank you. And again, he scored a 0, which is normal. Now we are going to move to the reading portion or the recognition. First, I have a sheet which is put out by the NIH stroke scale, which will allow him to read these, and that's a national form that is used. So, Mr. Jenkins, I have a sheet here I would like for you to read.
You know how, down to earth, I got home from work, near the table in the dining room, they heard him speak on the radio last night.
Very good. And he scored a 0 for that test. Now we're going to continue the test, the next test, which is articulation and or recognition. And so this is where I'm going to first have him to recognize some shapes and or objects and then read some tricky words. So first, can you identify the objects in this picture?
Yes, it looks like a woman, probably a mother, is at the sink washing dishes with the sink overflowing, and 2 children getting in the cookie jar. The boy is standing on the stool that's tucking over, and the girl is wanting a cookie.
Okay, very good. Next one, we have objects here that he will attempt to identify.
A glove, a key, cacti, a chair, a feather, and a hamburger.
Okay. Then we have some phrases or words that he needs to identify.
Mama, Tip Top, 50/50, thanks, Huckleberry, baseball player.
Very good. Okay, for that particular test, Mr. Jenkins scores a 0 again, which is normal. Now, the patient who has had signs and symptoms of a stroke, who maybe has even had a TIA or a stroke, they would have trouble reading and or recognizing those pictures. Now for the last test that we will do, and it's called an extension or inattention prick test. So I will have Mr. Jenkins to close his eyes, and I have this pen. Although I'm not going to hurt you, a little prick in the different areas, and he will just simply tell me if he feels them.
Yes, right forearm. Yep, left forearm, feels sharp. Right shin. Left leg, lower leg. Right cheek. Left cheek.
Okay, you may open your eyes. And that's the stroke assessment. Now, although Mr. Jenkins has scored a 0, which is very normal, he might have had a little TIA. He might have had maybe a sugar problem or a hypertension problem. So I want to talk to him about the signs and symptoms and what he should do. We'll talk about his diet, what he needs to do to modify it, whole grains, fruits and vegetables, the food pyramid to be considered. And then I also want to stress the importance of, if he feels the signs and symptoms of what he might think is a stroke or a TIA, that he needs to call 911. Also discussing maybe if it's his diet, I want to discuss exercise, incorporating exercise and getting enough rest. And if he's an alcohol drinker, the importance of not drinking too much, but in moderation. And if he's a smoker, I certainly want to give him some handouts on smoking and the dangers of smoking, and that it has, as far as these are all preventable items, hopefully that will prevent him from having to come visit us again. Thank you.